me start by saying if you asked any of the teams, either at Geisinger or Cone or Risant, no one would say this work is easy. But I do think there's validity to what you're alluding to, that this was fertile ground because systems like Geisinger and Cone had already been on this journey and had already sort of culturally embraced the value of value-based care. They've embraced the notion of you can do better with health outcomes, creating more consistency, making the right thing to do, the easy thing to do, creating that systemness, paying attention to what may have led to the patient landing in front of you today, and being mindful of what they may have to face tomorrow with whatever's going on clinically, as opposed to sort of these episodic encounters that you might see in a more fragmented world. So all of those things, I would completely agree with what you're saying. Geisinger had been on this path and done a lot of work already. Cone, same way. So these are systems that have not started from scratch. And I think that's one of our criteria, in fact, for looking at which kinds of systems would be a good fit for Risant. We know that the fertile ground, if you go back to that analogy, are systems that have already appreciated the value of a care model that looks different, wanted to pursue that path, wanted to pursue high reliability, consistency of approach, earlier access, and more timely recognition and treatment. I think these tenets overall for systems that really appreciate the importance of that, that makes for a better fit for what we're setting out to do. And then we know that if you, on top of that kind of fertile ground, you're able to layer on the best practices and the tech and enablement services and processes and sort of system re-engineering, if you will, that has been really developed over time at Kaiser Permanente. I think that's really the magical combination. You got the fertile soil, fertile ground, but at the same time, overlaying and bringing into that environment even better and more consistent tools to make that job even easier. There is change management with anything that you do differently, regardless of where it comes from. I think that much is true. But I think for systems that seek continuous improvement, there's a little bit of that already baked into the ethos that, wow, if there's a way for me to accelerate being able to move even faster and developing an evidence-based care guide kind of portfolio and being able to roll out systematized processes inside the hospital, something we call care without delay. I think these systems appreciate it because they're culturally already aligned around trying to get faster on that path. But that being said, of course, there's always change management anytime you introduce anything different. But I think overall the uptake has been pretty good. If you're looking at what percentage of the time are people using these tools and so forth, I think that's what creates the outcomes that we've already seen, just even in the early innings, is that the uptake is pretty good. I think it also gets to our engagement model as Risant, where yes, these systems are subsidiary organizations, but there's a lot of collaboration in terms of adapting these capabilities to work in their respective environments, because we also know that there's a lot of localness with healthcare, and it's absolutely the right way. And we want to be mindful of that. Each system has its own kind of dynamics and payer relationships and market dynamics that they have to juggle. But even within that, we know that some of these tools are able to create greater consistency and, as a result, ultimately greater outcomes.